Well, knowledge is power when it comes to women's health and reproductive well-being. And with 45% of pregnancies unplanned in the U.S., access to birth control options has never been more critical. A new survey explores women's attitudes towards birth control, and it reveals a disconnect between what women want and what their healthcare providers may be prescribing. Joining us now to discuss is Beth Battaglino, RNC and CEO of Healthy Women. Beth, welcome to the show. Let's discuss those survey results. What did you find?
So the why is, we did the survey because why is our numbers so high in the US of unplanned pregnancies? 40% of pregnancies in the United States remain unplanned, even though we have increased availability of birth control options, more so in the past 2 decades than we've ever had before. And here's what we found out. We found that 50% of the women that took our survey were concerned with unplanned pregnancies, yet out of those, 40% were not on birth control. So there you have it. 40% of the women are not even on birth control. So that's a yikes, right? We also found out in our survey that there were discrepancies in what women want and what healthcare professionals think women want when choosing a birth control option.
Interesting. Why do you think, Beth, that there's such a discrepancy between patients and healthcare professionals?
I honestly, as a practicing nurse, I think there's a disconnect in the conversation. This is a survey that Healthy Women did with Sabella Health, and we showed that less than half of the respondents said that they discussed contraceptions with their healthcare providers. But when you talk to the healthcare providers, 74% of them are saying, yes, we are having the conversation about contraception with our patient, but the patients are like, no, they're not. So no one's having the conversation apparently. And we need to.
Well,
we need to encourage better communication between patients and healthcare providers.
No, I think that's an excellent point. And quite frankly, us women oftentimes are very good communicators. So let's get this conversation going. Let's talk about the factors that the main factors women are looking at when it comes to choosing a birth control. We all know as women, everyone's body is a little different.
So true. And I'm so glad that you said that, because yes, our bodies are different. I think the number one thing is we want the birth control to be effective, right? So we want effective birth control. Some women even want their menstrual cycle, and we know that some contraception options actually stop your menstrual cycle. What we also found out is the need to do more education. According to our survey, 26% of women were not aware that IUD was an option that was better than oral contraception and condoms. It was more effective. So making sure that women understand their contraception options, make sure that we're having a conversation with our healthcare providers about contraception, making sure that we share any health history with our healthcare providers so they can work with us to kind of figure out what contraception options are best for me at this juncture in my life, because we know it's going to change. As younger women in our teens, we may have picked one type of contraception. In our 20s and 30s, when we're thinking about getting married and wanting to start a family, we may think about another type of contraception. And after we have our baby or babies, we want to decide maybe it's time for us to rethink a different type of contraception. So making sure that we're having that conversation, the contraception conversation with our healthcare professional, is so important.
Absolutely. Excellent points, Beth. Thank you for making those really quick before we go. If there's one takeaway from this survey that you would like to reach women with today, what would it be?
More education on contraception options and more research and innovation on new options to meet the continuing and evolving changing needs of women.
Excellent. Thank you so much for all your experience and wisdom. We appreciate your time today.
Thank you.
Again, for more information, visit healthywomen.org. Thank you so much to our wonderful guest.